Okay, so what is your name?
My name is Matt Partridge,
Where are you from?
Hampshire.
And are you a student?
Yes.
Where and at what level do you currently study?
So I'm at Oxford University and I'm going into my third year.
What is your current degree?
Medicine.
Can you briefly explain the application process for a UK medical school?
So the way that a general medical school application works is most courses, you get to pick 5 unis. Unfortunately for medicine, for some reason, you only get 4. So the kind of first thing you want to do is pick your universities, and you do that by going to open days and reading prospectuses and seeing how all their courses work and all that stuff. And then over the summer of the year that you want to apply, so the deadline is the 15th of October of whatever year, over that summer, you kind of want to start thinking about some experiences. I did a couple of days A&E work experience, maybe volunteering, working in an old person's home. I did some work with a disabled kids nursery charity kind of thing. Literally anything that shows that you have the qualities that would make you a good med student and a good doctor. And you can literally go and look these up. You go on the GMC website, or even like the Oxford, admissions website. They have a list of the qualities that they look for in a good medical student. And so what you want to kind of do, if you can, is put yourself in situations where you can demonstrate those abilities. Because what you're going to then do after you've done those experiences is you're going to write up a personal statement with all of those things in. And really the key to writing a good personal statement is highlighting 1 or 2 really in-depth experiences that you've had and showcasing, this is a time where I showed empathy and I did it in this way. This is a time where I showed communication and team working skills and I did it in this way. And that's really the backbone of a good personal statement, is really diving in deep and showing. Like, you don't want to tell someone that you're good at communication. You have to show it to them. And to do that, you need those good experiences that you kind of got over the summer. You get those experiences any way that you can. You want to kind of start writing a personal statement, drafts. You're going to do multiple drafts like August, September time. And then you kind of pass it down to, it's like 4,000 characters, which is like a page and a half. So it's really not a lot of space to get in every reason why you would be a good medical student and a good doctor. It's really quite tricky and it takes a lot of back and forth. So you're going to do that and then you send it off to those 4 universities. And then after that, there's a couple of different medical entrance test exams. So Oxford take one called the BMAT, Biomedical Admissions Test. The vast majority take the UCAT. You can do both. I did both. It's a bit tricky to study for both, but the kind of overarching thing is you can't really revise for them. You just have to practice, because they're just kind of like logic questions and verbal reasoning, reading paragraphs. You kind of want to start prepping for those maybe a couple of months in advance and doing some kind of drip feeding practice, essentially. BMAT is in November. UKCAT is August time, I think. So you have to do those, and then once the universities see your personal statement and your scores, that's when you'll get invited for an interview around November, December time. So for Oxford, I think they've stopped doing in-person interviews, actually, which is, I think I was the last year to have in-person interviews.
Oh, really? So
yeah, because the year after was COVID, and then since then
they've just online?
Yeah, they're just online. You'll have interviews sort of mid to late December, and then January-ish, you'll find out if you've got a place. They're the kind of stepping stones that you need to hit.
Okay, so likewise, the application process to Oxford, is that different?
It's pretty much how I described it, to be honest. Like I said, Oxford take the BMAT. There's a few different times you can take it. Oxford only like you to take it in November. The way that Oxford interviews work is you get 4 of them, 2 in the college that you apply to. We'll come back to this later, but I applied to Balliol, and so I had 2 interviews there, and then 2 interviews at Pembroke, and then between the interviews and mid-January, they kind of pick their successful candidates and say, you've got a place at this college, and I ended up at Pembroke. It's pretty much the same as other universities, except I'd say the main difference is the interview style.
So what do you think the main thing is that Oxford looks for in a prospective student?
So I'd say the main difference between Oxford application and other uni applications is the interviews. Essentially what they're doing is they're checking that you would be good in a tutorial. That's what that is. It's like a small group teaching thing. So what's unique to kind of Oxford and Cambridge and maybe a couple of other Russell Group universities is they'll sit you down with a problem and go, here's a thing, you've never seen it before, talk us through it, figure it out. And of course you're not expected to know it, but what they're looking for is the kind of problem solving aspect. Can you use reasoning to go, okay, this kind of makes sense, I'm going to go with this direction, and then you go, or then they say, actually no, you're completely wrong, here's what it should be, which is obviously part of the interview. They want to see how you deal with that, so they kind of want to see problem solving. I think things they look for in the personal statement is, like I was saying before, they want you to showcase the skills of a good doctor, so like empathy and communication and all that stuff. It's also good if you have other medical interests, like if you take an interest in some medical specialty, just anything medical related that you've done a little bit of reading on. So for example, I had like a like an atlas essentially of human anatomy. And I said in my personal statement that I looked at like cranial bones and that sort of thing. And I thought that was kind of cool. And then in my interview, because I'd written about it, they just put a cranial bone on the table.
Oh.
And they were like, what is this? And thank God I was able to say that's like a sphenoid bone because it's shaped like a butterfly and all that kind of stuff.
Good thing you were telling this.
Yeah, so that's the thing, right? Is
oh wow.
If you write about something in your personal statement, fully expect that they'll ask you about it. Fully can do.
Because if you've been brought to the interview stage.
Yeah, they expect that you know what you're talking about. You know, and of course they don't expect you to have medical student knowledge. But if you've said you've done the research, you've said you've done the reading, you better have done the reading. You better have done the reading, yeah. I guess that means integrity is another thing, right? Because if you turn up to the interview and go, oh, actually, sorry, no idea what I'm talking about there. Basically, you're out, isn't it? So,
yeah, for sure.
Yeah.
Oh, that is brutal,
yeah,
though, isn't it?
Yeah, but that's the thing. Like, I was able to sit there and say, I've seen this before, thank God.
That's why you're here.
Yeah.
On a similar vein, then, what is the best piece of advice you can give someone for the interview process?
It's like I said, they're judging how you would be in a tutorial, right?
Yeah.
So these people that are interviewing you, they are fully going to be your professors.
Yeah, so you mentioned to me before you recorded, so the person that you interviewed with is now
my head tutor.
Wow.
Yeah,
okay.
so in fairness, we don't have any actual tutorials with him because he's the head tutor, so he organises all the other tutors that do their own thing.
Yeah, of course.
But we speak to him kind of weekly when we're here. He's the person that we go to for exam results. He's the person that we go to if we're kind of struggling. You know what I mean? Like, he's directly involved in our learning, and he was my interviewer. And I feel like you don't get that in very many other places. So actually, when I went to interview at Balliol, one of the interviewers there, she ended up being my clinical genetics lecturer for like a month, and we had some tutorials with her. Like, they are our tutors. So what they're assessing is, are you going to be good in that situation? So what you want to go in and do is, you want to portray some confidence. You want to go in, big smile, shake their hands, sit down, and it's more of a conversation than it is an interview, because they're assessing you as a character as well as just your scientific knowledge and how well you would fit in a small group.
And almost how well you'd fit with them.
Exactly. Exactly. Like, if there's some personal chemistry there and you kind of get on well, even aside from, you'd fit well in a tutorial, you're leaving a good impression, and they're going to remember you way more than the person that just kind of sits down very awkwardly, hands
slightly too
like
professional.
Yeah, slightly too professional. Obviously, it's a very serious thing. Like, it's important. That doesn't mean you can't smile and have a bit of a laugh. That leaves so much of a better impression. Of course, you're going to be nervous. Yeah, if you start off well with like a handshake and a smile,
fake it till you make it.
Yeah, exactly. And like, honestly, compared to the other interviews that I did, they're so much nicer, they're so much more conversational. When I went for my Balliol interview, I fully walked into the room, and it wasn't let's sit across a table in like a rigid chair. It was just a sofa with like a flannel blanket on the back, and they were just like, yeah, let's just sit back.
Just chill, bro.
Yeah, exactly, yeah. And they weren't sat opposite me. They were sat, on a little corner, and they were just there just having a conversation. I went to Southampton, and it was, you got 5 minutes, sit down. So
likewise, what do you think the best piece of advice you have is for people taking the UCAT, the BMAT?
Start early, start small. You cannot revise for either. You can revise for section 2 of the BMAT because it's scientific knowledge, but it's GCSE scientific knowledge. Like, hopefully you shouldn't need to revise too much for that. The thing about UCAT and BMAT is it's really, really quick, and it's just a skill that you have to develop. You just have to put in the practice. So if your thought process of UCAT and BMAT is, I'll just do a couple of weeks of revision, it's not going to go well for you, because it's a skill you have to develop. So if you start early, there's loads of free practice questions, question banks all over the internet.
By start small, what do you mean by
As
that?
in, you don't have to do hours and hours a day.
Yeah, just get into the habit.
20 minutes, half an hour, at max. Do that every day consistently. And it's a skill that you develop, especially, so there's a UCAT section called abstract reasoning, which is literally look at shapes and identify patterns. And it's so random, and like, no student has ever done that before. Sit down at look at a box of squares and circles and triangles and go, yeah, there's a pattern here. And the reason for starting early and starting small is you get through a higher volume of questions, which means you can just build that skill up. It's honestly skill-based as opposed to knowledge-based.
So what is your best piece of advice for anyone doing their personal statement?
So I think what a lot of people try and do is go, oh my God, I've done all this stuff. Look at me, I'm really proactive. I've gone to the hospital, and I've gone to a GP, and I've worked in a pharmacy and everything. There's just not enough space to talk about all of that and also showcase, why it is that you would be a good medical student, doctor, whatever it is. And at the end of the day, all it really shows if you write all that stuff is that you have a relative that works in the NHS. So what you want to do instead is, again, like I was saying, pick one example, 2 examples max of, this is what I did, this is specifically a situation that I was placed in, and this is what I learned from it, this is how I reflected on it, this is how I will use this situation to become a better doctor. Like, it takes up a lot more space, but it shows volumes more than, yeah, I worked in a GP for a week. And it also means that you don't need to do as much work experience. Like, if you're struggling to find work experience, don't worry about it. You just need one where you can showcase a potential skill. Just pick one or two and explain it in detail.
For you, what was the most difficult part of the application process?
Interviews, probably. Personal statement is just kind of shearing it down to getting the most out of a small amount of words. BMAT I did quite well in. I think interviews were very up and down for me. So my first one I think went quite well. It was about clinical genetics and ethical situations. I thought that went okay. And then the second one, they showed me this random, if I said gel electrophoresis, do you have any idea? No, okay, fine.
I'm sorry.
That's fine. And it's basically a form of DNA testing, essentially. And they showed me this and like a bunch of random pictures of embryos and all this sort of thing, and said, what's going on here? And I completely blanked. And this was at Balliol, so that didn't go particularly well. Like, I muddled through it, and it was a lot of statistics and looking at graphs, and I kind of struggled with that one. Pembroke interviews went a lot better. So the third one was, again, with my head tutor. It was a question on the gut-brain axis, so how what you eat could influence your, how you view food and all that sort of thing. That one went quite well. That was really interesting. And then the fourth one was about my personal statement, like I was saying about the whole cranial anatomy thing and everything like that. And again, that one went quite well. But there were points during all the interviews, and this is the point of them, right, where you kind of go, what am I supposed to say here? Because it's a problem-solving exercise. They can see how you respond to it. Like, it's a part of the interview that you're supposed to get stuck. And I think I didn't fully understand that at the time, but obviously they went, pretty well on the whole.
What grades did they want from you?
I believe it was 2 A stars and an A.
Okay.
I'm fairly sure. They might have changed it in recent years.
So, and what grades did you get?
I got 3 A stars.
Okay.
But that was during COVID when, we were just given grades, essentially. Yeah. So my A levels were cancelled. So I was given those grades.
You got 3 A stars, man. Yeah, it was.
I was given those. Yeah.
And what A levels did you do?
So I did biology, chemistry, and maths, and then music performing on the side.
And which was the most useful? I assume the music performing was.
Yeah, music performing, maybe not so much. Probably biology. But there's a lot of biology that was kind of irrelevant, like all the plant biology stuff, immediately useless. Actually, I don't know between chemistry and biology, because chemistry, you come into, how do all the drugs work? How do they bind to all their receptors? That's all chemistry, isn't it?
Yeah. And so would you say equally?
Pretty much equally, yeah. Yeah, I think so.
Do your GCSEs matter?
Not as much as people might think they do.
But they still do?
I think when you're trying to get into a place like Oxford, and you've got all these people with amazing BMAT grades, and we're pretty much all straight A students, otherwise you wouldn't get an interview. When you're looking at people like that, and it's so hard to tell people apart, then they might go back to GCSEs and go, okay, in order to tell these people apart, we need something else, GCSEs. Yeah. But that is way down on the on the priority list. It's a deciding factor if there's absolutely nothing else in it.
Also, do you think you were adequately prepared for medical school?
Yeah, I reckon I was. I think I was really lucky at my college that they had a whole med school prep course.
Oh, did they?
Yeah. So we did like interview prep, we did BMAT prep, UCAT prep for like a solid couple of months. So maybe not prepped for medical school, but the whole prepping for the application process and getting me in here. So yes, I think so.
Is there anything you didn't expect or were surprised by your degree?
I think I wasn't surprised by it, but the fact that you can just not turn up to lectures. That's not necessarily a medicine specific thing or a degree specific thing.
I'd agree.
It's just like okay, I don't have to be here. Like, obviously I'm going to go to the majority of them.
But I think that's you growing up as a person, because you're an adult now. No one's going to tell you off.
Exactly.
But at the end of the day, you're paying for it.
Exactly. I don't think there was anything that surprised me that much. I was prepared for the step up in workload, so it wasn't a surprise, even though it was a step up.
Did you always want to do a medical degree and be a doctor? And if so, what inspired you?
So I always wanted to do something sciencey, but it took until first year, maybe even start of second year of college to go, yeah, actually medicine sounds kind of cool. I was erring on research scientist for quite a while, and honestly, I'm still kind of back and forth. Yes, being a doctor sounds amazing, but if I can find a job where I can see patients all the time, but not have to do 80-hour work weeks and, do a proper grind, I'd appreciate that more if there was maybe some, like a little bit of research on the side of it. So actually quite late by some people's standards.
Is a medical degree for everyone?
No, like you can't say that. I mean, there's different degrees, right? So even within medicine, there's my 50-50 split, which I personally would prefer. So I've got 3 years of preclinical, 3 years of clinical. That's for me, that's not for everyone else. Other people want to get straight into the hospital and start doing stuff. Like I said as well, you have to have the kind of work ethic of I've got to sit down, put the hours in. But again, that's the same for a lot of degrees. You can't be here unless you enjoy it. If you're not prepared to sit through a lecture and go, oh yeah, that's really interesting. I'm learning about basal ganglia today, which is like a brain structure basically, and go, yeah, this is really, really fascinating. Of course, it's not for you. There's going to be parts of the course that you enjoy, parts that you don't. You can't say that it's for everyone. There's something out there for everyone, I would say. You have to find it. You can't just go, yeah, this is a medical degree, this will be fine for me.
Now, does being squeamish matter when you go to med school?
So, yes, I haven't had to put up with that much yet.
Okay. Are you squeamish?
No, I'm not squeamish. So, a couple of people don't like the look of blood. They're going to have to get over that. They're just going to have to, unfortunately. In second year, we've had some quite messed up specimens. So the one that sticks in my head was an entire head that's been cut up by 10 centimeter sections, and each section has been encased in like a little box. So you can put the head together and it stacks, and it's an entire head, and then you just take the stacks off and you can look at the brain and all the structures and that sort of thing.
That's a surreal
it's really strange. I've held brains, I've held spinal cords. There's,
I hope as part of your degree and you haven't
I just found one on the street and decided to pick it up. No. Well, I've seen, babies in jars. But yeah, there's a lot
of difficult images.
Yeah, we've also done a few experiments on guinea pigs.
In summary though, would you say being squeamish matters?
Yes.
So what is the best piece of advice for someone choosing the right university to apply for?
I mean, there's so many different things you have to take into account, right? So first thing I would actually do is say, well, okay, how far away from home do you want to be? You've got to put what you want over what the university can give you. Choose what you want first and then select based on that, rather than picking university and trying to fit it into what you want it to be.
Now, you've mentioned that. Did you ever consider studying outside of the UK?
No, I didn't. Like I was saying, you got to pick what you want. I never would have wanted to go abroad. I would have just preferred to stay, not close to home, but I would have wanted to be able to come home for the holidays relatively easily, sort of thing. And so my thing was finding universities that allow me to do that. Oxford's quite close to where I live.
How convenient
so I can just
that,
yeah, exactly.
So what is one bad bit of medical school preparation advice?
One thing a lot of people did, which I think they shouldn't have done, was go in their rooms and study. Prepare for the interviews. And it's like, at that point, what are you doing? You should be out talking to people. Exactly, talking to the people that are here, trying to de-stress a little bit, making those connections. Obviously, that's a bit irrelevant now because it's all online, which is...
If practice makes perfect, isolating yourself is the opposite of what you should
exactly,
be doing.
Right. And if you're at the point where you're 2 hours away from the interview, nothing you can do in those 2 hours is going to improve your chances. Calm yourself down, get yourself in the right headspace. So yeah, I guess if that's one thing that you shouldn't do, shut down, study, and take it really, really seriously. Like go out there and try and make some connections and relax a little bit, because it will come across in the interview.
So how did you prepare outside of your A-levels and application process for your degree? So you mentioned you did some work experience.
I did a couple of days in like an A&E department, basically.
Okay.
Which was quite cool.
And then you said you also worked with some children, was it?
Yeah, so I did it for about a year, actually. So I started off doing it because it was something that would get me into medical school, and then I just ended up staying because I enjoyed it. There's this organisation called Challenges, which is it's basically a nursery for disabled kids, essentially, and it's a place that parents can drop their kids off, and we'll look after them to basically give the parents a bit of day off from looking after their kids all week. It's a place they can come, have some fun, that sort of thing. And that taught me, I guess, how to deal with potentially stressful situations. I guess communication as well, because a lot of these kids, they literally cannot verbally communicate, which is something that you're going to get in a hospital situation where a patient may be non-verbal and you have to actually find another way to communicate with them. So that was quite a good, learning point for me. And it's like I said, something I wrote about in my personal statement is I learned to communicate. Here's a specific situation where I had to find another way of communicating with this child. So that was good preparation. I worked in a care home. I'd say they're the main points, really. So I didn't get loads.
Can I ask you a very simple question? Was it hard to get in?
To Oxford?
To Oxford.
I mean, yeah.
Yeah.
Yeah. No, it was. It was quite a shock when I got the email. I got an email in the library. I looked at my phone and I went, crap, I got in. And then my friend took it, shit, you got in. Oh my God. And that was it. It was the sort of thing where it's like, I'm confident I can get into a medical school. St George's was tough, and I actually got rejected from St George's. They didn't like me, but I thought as long as I can go somewhere, I might as well try Oxford because it'll be cool.
What would you say are the best kind of books, TV shows, or any movie suggestions? Just kind of media suggestions.
Again, it really depends on your interest, right? You have to find an interest and then delve deeper into it. One thing that I did was it was actually a Canadian podcast, like an A&E emergency trauma podcast kind of thing, and it's just on Spotify, and I just kind of listened to it, and it gave me some talking points to kind of go away and research. So that was quite cool. There's the one that everyone reads, which is This Is Going to Hurt by Adam Kay.
I'm sorry, that's my favourite.
Everyone
book.
is.
It's my favourite.
Everyone has read
I'm not
that.
even a med
There's
student.
like the man who wore his wife for a hat. You know, there's the.
I haven't heard that one. Was it Man?
It's a man who wore his wife for a hat. When breath becomes air, all that sort of thing.
That's such a good book.
But everybody reads those. So if you want to talk about something that's going to make you stand out, you want to look at actual medical research if you can. So I started looking at gastrointestinal bleeds because they were just talking about them, and I thought, oh, that's kind of cool, I'll look at that. Or if you already have another particular interest, go and find a random scientific article. Read it. You don't have to understand it all, but be like, yeah, I've read this thing. This is what they were trying to do. This is what I learned, etc., etc., etc.
So to summarise entirely, what is one piece of advice that you would give someone applying or wanting to apply to medical school?
Plan it out. Start early so that you're not rushing. You know, think about work experience early. You know, what you don't want to be doing is absolutely cramming in October time, trying to write your personal statement and prep for the BMAT and start thinking about interviews all at the same time. And like I said, start early, start small.